right, these are your hip flexibility exercises. We're gonna start with the modified Thomas stretch with a strap. It's gonna go on your back leg. You have one leg off the table, scoot as close as you can to the side. Bring your heel towards your butt. Mistake patients when they do this is they do this, right? And this is then just a knee range of motion exercise. We want to get that hip drop down, so we stretch out that rec fem. We get the hip flexor involved in that stretch. Your classic Thomas test. It's gonna be at the very edge of the table. So basically just your belt line is on the table. Use your other hand to come back and then let your leg hang. All right, the mistake that patients will make with this one is they won't go far enough off the table. They'll just go to where they feel like it's comfortable, and then they'll go down, and then their whole thigh is resting on the table. This is no good. What you want is belt line right at the edge of the table. Then you're gonna lean back, hold that one thigh and let the other one drop. Stretching out this hip, sir. Next we have our half kneel progression. So we're gonna do here. So your half kneel stretch. So right now I'm stretching out my right hip flexor. So your progression, so again, chest up, lean in, stretch your hip flexor. You can use it going this way. Again, the mistake patients will make is they'll turn and go this way. It's not bad, but that's gonna more stretch this left leg. We're looking for the stretch on the right, so you're still gonna push your pelvis straight forward, stretch your right hip flexor, and then we're gonna bias a little bit more the lateral. Now again, twist so you're going straight and push forward. And again, patients will either go too far this way, or they'll try to really over twist and just try to twist instead of pushing forward. And that'll be a stretch on their left hip. We want the pressure going forward, straight on, so you feel the stretch in the left hip, in the position that I'm in. You can add a super band. I have my 50-pound resistance super band right here. So that would go around the hip that's down, the hip that you're stretching. So it's gonna give a little posterior glide. And you could do it the same way here and going across here. Fencer stretch. I'm gonna show you over on this side. Fencer stretch is the same way. Right, they call it a fencer stretch because you lead with your feet like so. To keep it consistent, so I'm keep stretching my right side. Same thing, so we're gonna go here, chest up, lean forward, you want a nice open stance. You can step out, but again, still push the hip forward. Don't push the hip this way. Go across, pelvis going straight forward, stretching the right hip. And then you can do all these same 50-pound super band around the hip. Do a little posterior glide as you're going for the stretch. Here, and, oh, lost my balance. Forward, here. All right. That's your fencer stretch progression. Next, we're coming over here for your couch stretch, or the half kneeling progression. All right, so you can just add, you can do all those same half kneel progressions. You put your foot on the chair or the couch. That's why they call it a couch stretch. Go forward. This will get more of your quad because we're getting a deep knee flexion. And then you could do it the same way, going here and or coming across, going here. All right, then we have your single and double kneaded chest exercises. So you can do them without any equipment. Leg extended is going to keep the lumbar spine more in an extended position. Although then when you bend your knee, you bring it into flexion on that side. You can keep it a little more neutral here. Probably get a little bit more stretch. Your double kneaded chest will be here. Some patients will do it better with the ball. So again, you're gonna have them most likely with the other knee bent a little. Come in here. They can pull, or if they really have limited range of motion and not too much core strength, you give them a strap around their knee, around their thigh. You're gonna roll the ball in, pull for a comfortable stretch. Same idea. This can be a challenging stretch with double knee, so you can start kind of like more as an active assist to get some more motion until they get more motion, and then use the strap to actually make it into a stretch. Okay, prayer stretch. This is child's pose or prayer stretch. You can do it a few different ways. So to stretch more of your lats, you're gonna have them reach into more of a shoulder flex position to start, and just try to keep those hands there and sink their butt back without moving their hands. This will be more for a lat stretch / a thoracic component. If you want to get more of the hip, more of the low back, right? To bias the low back, you're gonna have them do that posterior pelvic tilt with keeping the hands close to the body, and keep that posterior pelvic tilt as they sink back. Right, so if they don't get too much of a stretch, come out a little more. Posterior pelvic tilt, sink back. And then if you're going more for that hip flexion stretch, just have them keep their back relaxed as they sink back into it. Okay, and then we can add, if they're having difficulty getting into there because of their limited hip mobility, limited joint mobility, you're gonna again wrap it around the anterior side of the hip, so it gives a posterior glide on the hip as you sink back. You're gonna get a good pull on that joint as you're sinking back into that hip flexion position. You can also flip. I'll switch legs so I can show you here. You can use this as a rocking position for a lateral glide on the hip. If we want to get a nice lateral glide on the hip, you can do it here in the same position, rocking back and forth, getting a lateral glide in various ranges of hip flexion all the way to hip extension. So we can come all the way to a hip extended position, all the way to a hip flex position with the lateral glide mobilization movement. So next is our hamstring stretch. to our stretch out strap. So for the hamstring, we're gonna place the strap as close to the heel as we can so we can bias the hamstring. If you go more your foot, you're gonna bias more of the gastroc and sciatic nerve. And if you go at your toes, you're very much biasing that sciatic nerve. So again, we're trying to go for just a hamstring stretch, so we want it right at the heel, so the foot can be relatively plantar flexed. Keep the knee extended the whole time, up till you feel a stretch in the hamstring. You can do this by pulling the knee in towards your chest and then straightening the leg. Again, same thing, keeping that foot plantar flexed so we're not biasing the nerve. Oh, and then for this contract relax portion, you may use a stretch out strap or a super band if you want to. They're gonna push into the band, so right now I'm trying to push my heel towards the table, then I let it relax and pull, push into the table, against the band, and relax and pull, push, and pull. And you can do that all the way through their maximal range for a contract relax. Long sitting hamstring stretch. Some people say this gets a little bit more of that popliteus in the back of the knee. You're gonna give a good knee extension here and then raise the leg. Again, you could do your gastroc here. Again, depending on where you put the strap is gonna bias how much gastroc component, nerve component you're gonna get into that stretch. Bent over hamstring stretch is from the chair. A little bit tougher. The idea with this stretch is that you take off all the slack of the lumbar spine as much as you can into that. So now we're just using the mobility through the hamstring. All my lumbar mobility is taken up, and now we're just going for a hamstring stretch. Okay. Standing ITB. So you're gonna cross your leg over and reach across here. Let me back this up. So you can do it from the table or along the wall. So pushing my hip out. So some people will cross their leg behind. So I'm stretching my right hip right now. So I'm crossing it, extending my hip, and then side bending to get a little bit more of that adduction in the standing position. And you can change the angle. And so now I'm biasing a little more spine, a little more QL, or I'm gonna push out my pelvis more for the more adduction at the hip and get more of my hip stretch. TFL stretch off the side of the table. So we're gonna put this one around the foot again. So again, for a TFL, we need some hip extension. We need some hip rotation components. So you're gonna put the strap around your bottom leg to get that hip external rotation, extension, adduction component. Right, so the classic stretch here for the quad takes out that hip external rotation component. Just have to be careful because sometimes patient's medial knee will not like that position. However, it's a good position to get that TFL to get a stretch. Another, obviously much softer way to stretch these muscles compared to the way I just did. You're gonna double up some pillows high up. That way we get some lumbar hip extension. So you want to straighten that leg for that lumbar extension. I'm doing my left leg right now and just dropping into that figure 4, coming in. If you can cross it over, drop it in, get the hip adduction, hip extension, and external rotation. You get a nice TFL stretch there. Need opposite chest is another way to get this stretch. This is going to be more of your piriformis coming across. So you try not to go too far up towards your chest, more towards the opposite knee, more adduction than flexion, adduction. Sorry, flexion, internal rotation. This one more of that adduction moment. Just depending on the patient will get you more or less of their piriformis compared to their glute min. We're gonna go to our figure 4 position. So I'm gonna get to here so I can show you with the super band. Okay, so our figure 4, it's gonna be this position that we were just in. So going towards the opposite hip, going towards the opposite shoulder, or you could do whenever you push out. That's gonna be more of that TFL that we were just doing in supine on the table with the pillows. A nice way to get a little additional mobilization of movement to put that leg through. Get on the anterior side of the hip, have it give a little pull, and then you can go through those same motions. Push. You can even try to resist, a little resistance with it. They can pull, and they can hold it. You can have them do holds in all different positions. You can have them do a little internal rotation, contraction, activation here, and then get that stretch. Those are going to be your piriformis, your knee to opposite shoulder, windshield wipers we already did. Butterfly stretch. Your hip adductors, right? So again, so actually I'll show you from this position. So we don't want this rounded position. A lot of times I see patients trying to push almost their chin towards their heels. What you want is for them to come out of that position with as much lumbar extension as they can. Bring it in, and then bring their hips forward by pulling, using their arms and pulling their heels towards their body, trying to push their sternum or their belly button is the cue at what going towards the heels, not their chin or their upper chest. That way we get more of that hip stretch instead of a lumbar flexion stretch, lumbar thoracic flexion stretch. So there's your butterfly stretch, your adduction on the wall. So your hip adduction on the wall. It's good for a prolonged position stretch. Scoot your butt as close to the wall as you can. Knees on the wall. Slowly drop your legs out to the side as much as you can. Stretch your adductors. Pigeon stretch. One more for the glute in here. So I'm stretching my right hip, cross it over into adduction. Now we're getting that external rotation coming across the body. And you should feel this stretch in the right glute min. I'm going to switch over and stretch my left so you can see the super band. So again, super band on the anterior side of the thigh. That way we can get a posterior glide stretch. Cross the leg over. And then lean into the stretch. Prone press up or the cobra pose. You're gonna be here. Prone press up. All of this is like a half push up, trying to keep the pelvis down. Cobra pose, you're gonna try to push down a little bit, and if you can, raise your body up. All right, so not only going into the stretch position, and then lift your body into that position. Would be your cobra pose. 90-90. And progression. So you're gonna start, so with this exercise, the closer your knees are, easier the stretch is. Further you open your legs, more difficult the stretch is. So this is the initial position for the 90-90, meaning 90 degrees at the hip, 90 degrees at the knee. And then from here, once you fall into this position, you can start playing around with the position by twisting. You can add a reach. You can do like we did with the cobra pose. Plant yourself here and do some lifts. You could do some lifts. You could do some lifts. Do some lifts with this heel here. Do some lifts with this knee there. Right? You can do some reach and pulls, pushes and pulls. You can use a weight to do a push. You can use a band to do a pull. Obviously, anyone who has a flexion, rotation, compromise in the spine, this is not what we're going for. You can add your little plank motion here, going up and down, kind of like a Turkish get-up. Add some resistance there. And then, of course, you would switch over and have them do all those same motions on both sides. Next, we have our open and close the gate. So open the gate would be, let me step back a little bit. So open the gate would be this way, trying to get that 90 degree. Close the gate would be with this leg, 90 degrees. Right, so you can put it here. If you're using the cone as a target, a little cone. All right. If you don't have the cone, same thing like we'll see when we do the hurdles. If you don't have the cone, that's okay. They don't need target. Teach them the motion. Teach them where their foot should be. Bring it back in. Same thing. Teach them where their starting point is, where their ending point is. You don't need a cone. They can do these pretty well at home without any equipment. And our last one on the hip flexibility is gonna be the hurdles. So you're gonna start with them going over the external rotation. Obviously, I have to face it this way, so I'm gonna show this way. So you're gonna go up, over, over the hurdle, step through, take your butt down, and come around, right? So as they're going under these hurdles, we're not looking for a lumbar flexion or a hip hinge. They wanna go straight into that deep squat, keep their chest up as much as they can. Same thing here when they're going up over the hurdle, not letting their pelvis collapse. And then rotate. So we're going to open the gate into the hip hurdle.